Hey there, pharmacy students. Got exams coming up? Then you know semi-solid dosage forms are a huge topic. Well, in this explainer, we're going to break it all down for you. We'll focus especially on creams, everything from how they're put together to how they actually do their job.
All right, so here's the game plan. We're starting with the basics, then we'll get into telling the difference between ointments, creams, and pastes. After that, we'll zoom in on creams, aqueous versus oily. We'll also tackle the super important topic of bases, touch on how they're made, and wrap it all up with a quick recap of everything you absolutely need to remember for your exams.
Okay, first things first, let's lay the groundwork. What are we even talking about when we say semi-solid dosage forms? And, in the world of pharmacy, what does an ideal preparation even look like?
So right off the bat, you need to get this. These are not just simple goops. No, they're actually pretty sophisticated systems made for the skin. The whole point is to get a specific effect, either right there where you put it, which is a local effect, or for the drug to get into your bloodstream for a systemic effect. And really, the secret sauce is all about how that active ingredient is mixed into its base.
Now, for your exams, this is a lifesaver. Just remember these three categories for the ideal properties. First up, physical properties. You want it to feel smooth, not be a greasy mess, and definitely not stain your clothes. Then there's physiological. It shouldn't irritate the skin, right? And it needs to play nice with your skin's natural secretions. And finally, application. It's got to be easy to put on, it needs to actually release the medicine, and this one's a biggie, you need to be able to wash it off easily with just water.
Okay, with that foundation in place, let's move on. We're going to tackle the big three: ointments, creams, and pastes. Seriously, knowing how to tell these apart is a classic exam question, so you'll want to pay close attention here.
This little comparison is super helpful. You can see right away that creams are the lighter, softer ones, while ointments are, stiffer and greasier. But if there's one thing to burn into your memory for your exams, it's washability. It's a huge deal. Creams, easy to wash off. Ointments, good luck with that.
And then we have pastes. What's the deal with these? Well, the key feature is a massive amount of insoluble solids. We're talking over 50%. That's what makes them so thick and stiff. So while you might rub in a cream or an ointment, a paste is really designed to just sit there and form this protective layer.
All right, let's really focus on creams now. This is a massive topic for exams, and it really boils down to two main types that you absolutely positively have to know.
First up, we've got aqueous creams. These are what we call oil in water, or OW emulsions. So just picture tiny little drops of oil floating around in water. That's exactly why they feel so light and non-greasy, and why you can just rinse them off. The perfect example of vanishing cream. It literally feels like it vanishes into your skin, no greasy film left behind.
And on the flip side, you've got oily creams. These are water in oil, or WO emulsions. So this time, it's tiny drops of water trapped inside a sea of oil. And that structure is what makes them feel greasy and heavier and, well, pretty tough to wash off. The classic example you need to know is cold cream.
So we've got the cream types down. Now let's talk about what holds it all together, the base. And let me tell you, this is a super high-yield topic for exams. Why? Because the base you choose determines pretty much everything: how it feels, how it looks, and most importantly, how it releases the medication.
First up are the oleaginous bases, also known as hydrocarbon bases. Think petrolatum, like Vaseline. These guys do not mix with water at all. A pharmacist would use one of these for its occlusive effect. It creates a barrier on the skin that traps moisture, which is fantastic for really dry skin. The downside, and this is a big exam point, is that they're sticky, they can stain your clothes, and they are a real pain to wash off.
Next, we have absorption bases. Now, these are kind of clever. They start out anhydrous, meaning they have no water in them, but they can soak up water and form a water-in-oil emulsion right on the spot. Think wolf fat, which is lanolin, and beeswax. They're still on the greasy side for sure, but they're super useful when you need to mix a water-based drug into an oily base. Plus, they tend to spread a bit easier than those heavy hydrocarbon bases.
Then you have emulsion bases. Honestly, these are basically just creams that are all ready to go. You just need to add the active drug. They can be either water and oil or oil and water, but the OW type is way more popular. And the reason is pretty obvious. They're not greasy and you can wash them off with water. That makes them way more pleasant for patients to use. We call that cosmetically elegant. And finally, we've got water-soluble bases. People call these greaseless bases, and for good reason. There are no fatty or oily ingredients in them at all. They're made of things like polyethylene glycols, also known as carboxyls.
Because there's no fat, they're a breeze to wash off, and they don't block the skin. This makes them perfect for situations where you've got wet or weeping skin, or for places like the scalp where nobody wants a greasy mess.
Okay, so we know all the puzzle pieces now, but how do we actually put them together? Let's go over the most important method for making these, especially when it comes to the creams we've been talking about.
The emulsification method is the big one. It's pretty straightforward. You've got your oil phase and your water phase, and you prepare them separately. But here, and this is the absolute key for your exam, you have to heat them both to the same temperature, usually around 70 degrees Celsius, before you even think about mixing them. And why is that so important? Well, if you pour hot oil into cold water, the waxy stuff in the oil will just clump up instantly. You'll get a lumpy disaster. Heating them to the same temp lets you create that nice, smooth, stable emulsion as you stir everything together and let it cool.
Okay, that was a lot, but don't worry, let's boil it all down to the absolute essentials. These are the key takeaways you'll want to have locked in for your exams.
Look, if you're cramming and can only remember 5 things, make it these 5. 1. Know what a cream is. 2. Be able to tell the difference between an aqueous OW cream, think vanishing cream, and an oily WO cream, think cold cream. 3. Know those 4 main base types: oleaginous, absorption, emulsion, and water-soluble. 4. Remember what makes a paste, that huge, over 50% solid content. And 5. Never, ever forget that washability is the big-ticket difference between creams and ointments.
And there you have it. That's your crash course on creams and semi-solid dosage forms. So as you go back to your notes, just keep this in mind. Choosing between these different formulations isn't just about whether it feels nice or looks good. It's about how it directly affects how well the medicine works. So keep that question in your head, keep studying, and you're going to do great on your exams.